Hey guys, how you doing? My name is Maddie and I have another video called My Easy Peasy Neck Surgery, ACDF and Back to Teaching at 54 or something like that. And in that video, I explained to you the reasons why I really had a fast recovery, and it was meant to be an optimistic message for people who have the same surgery as I had, because I guess when we get to this point of needing surgery, we want to see the experience of other people, not only doctors' recommendations and what really happens during surgery, but how people recovered. Because I guess this is very inspiring, and I relied on the YouTube community for all my pre-op and also for my post-op. So this is why I'm going to tell you the reasons why I almost sabotaged my recovery. Well, so the first thing I have to tell you is even though I went back to work after only 2 weeks post op, when I was around the 10th day, oh, my cat is around here. When I was around the 10th day of surgery, I noticed a very sharp pain around my left shoulder blade. It was like a nerve was pinched, which I think was actually the case. And I started wondering, why did I have this kind of pain when I was so careful with my recovery? I tried not to do any dishes, I didn't lift any weights, I tried to sleep as much as possible. I slept for even 15 hours a day. So what I realized retracing my steps was that on the third day post-op, or second, I think, I was at my son's house, and the sink is super high there. And I saw some dishes, and I started doing the dishes. Imagine, this was 2 days after the doctors had cut me open and did a lot of things to my spine. This weren't a lot of dishes, and I walked around the building a lot as well. It was good, but it surely wasn't something wise to do. And then I came home, and I spent most of my days lying down because my mattress is so comfy. It's good for my lower back, where the real problem lies. It's even worse than my neck. So there I have a very good position the way I set up my pillows, and I didn't need to to wear my neck brace, even though that is a soft one. But to sleep, I could only put some pillows under the curvature of the neck, so it was cool. And I listened to podcasts and watched a few series just to try and completely forget about work for 2 weeks. And what I didn't pay attention to, I lifted my pillows high enough so I could lean my arm onto them and only hold my phone. But I didn't realize what a strain that was putting on my arm. And even though I watched the videos like this, there was always a little strain on your neck. I think I did this position a little bit, and I think it certainly got a strain on that part of my shoulder. Never mind my cat yelling; he wants attention. I've just given it to him. And also, I did something else. Since I recover very fast, I know I'm sometimes reckless. I decided to make some art some 5 days after I had my surgery, and I put things on top of here, and it required me. I couldn't lift the art that I was making. I had to lean forwards, and to do that, I did this on on my left arm, since I'm right-handed. Can you imagine my poor left arm, holding all this weight of my torso? It was, I think, very damaging for my pain. I didn't feel it on that day. I just felt a bit more sore. But in hindsight, it wasn't wise to do that. And you won't believe what else I did. On the 10th day, I was feeling great. So I went back to the school where I work. I teach kindergarten and also high school. I work part-time, but the other part of the time is always here on the desk, planning things and preparing tests. So I basically work full-time. And I was really pumped, and I put some makeup on, and I did my hair, and I was saying hello to everybody. If it was up to me, I would have started on my 10th day. And after that, and I came home, and I didn't feel like waiting for my husband to vacuum the apartment on the weekend, and I decided it was a good idea for me to do that. So this I only remember today. So can you imagine? It was awful. I shouldn't have done that at all. And then this pain really got to me. And about on the 10th day, like that Friday and night or that weekend, I had to go to the ER for pain meds. And the only thing that really helped me was morphine. And but of course, when it wears off, you're back with that pinched nerve again. And as I was almost getting back to work, I would go back to work on a Tuesday, and this was Monday evening. I had a lot of pain. Nothing would relieve my pain. Uh, I went back to the ER, but this was like 1 p.m. or sorry, 1 a.m. And they kept me there for meds, but this time they didn't give me the morphine. They gave me lots of other things that none of them worked. The only thing it made me was pumped full of meds and drowsy, and I don't know. I came back home, slept a couple hours, then I went to the school to start working. And fortunately, it was the only class where I can sit, because I'm normally standing, walking, squatting, tiny people's shoes and stuff. But I realized how bad it was, so I had to be taken back home. It was embarrassing. It was bad for the school, for me. It ruined my confidence. I doubted that I would get better because I was in such pain. And I had also missed 2 appointments with my nurse, the nurse who has direct contact with the patients post-op, um, because I was already going back to work and I was super busy, and I set lots of alarms and I forgot. So when things got really ugly, I didn't have the guts to call her back, and I contacted the clinic right away, and they asked me to have the X-ray that they have people do a month after the surgery, to see if the screws are in the right place and the cages that they use to substitute your discs. And everything was right, but there was obviously this pinched nerve. So I ended up having to deal with it by myself. I mean, with the help of a masseuse, who fortunately had those I don't know how to call that machine that has some electrodes that they stick to your skin, and they emit some electroshocks. That really helped me. But it was like 4 evenings with that, and even with massage by hand, it wouldn't help. But slowly, I got rid of that awful pain and went back to work. But what my message here is, I guess I don't want to. I mean, I don't want to say that what I said in that video is not true. It really is possible for you to recover fast if you take care of yourself. But as you can see, in 2 weeks I was back to the classroom, and I could have been so much smoother if I had been a little more patient, because people want to help you. They surely do. There was always somebody offering to carry my backpack, and it was super, super light. I carried only this strictly necessary things. Not even my water bottle was full when I got to work. But I think I should have asked for more help. I think you should do the same in case you have the same problem as I do. Maybe it's a woman thing or if you're independent and you don't have the patience to wait for other people to do things for you. I think maybe in advance I should have arranged for someone to go downstairs, pick my stuff, do everything that I needed, because it's such a sensitive surgery to have. And I'm talking for myself, because my surgery wasn't really that, I mean, not, it wasn't serious, but it was. But I believe that many people are going through this procedure because they have lost their sensitivity in their arms, or they have tingling legs, or their legs sometimes don't even function anymore. I hope it's not your case, and I would love to hear what your case is. And I heard that some people, they feel immediate relief after they have surgery. So I will encourage you, if you're going to any procedure in your spine, or others, when you end up here, I would really strongly um, encourage you to pace yourself. This is what I said on the previous video, but I hadn't told you that I hadn't paced myself enough. I hope you take really good care of yourself, and I'd really like to know what kind of surgery you're having or you had, and what kind of symptoms you have. And I hope these these mistakes that I made will prompt you to do your own. I'll help you. You're careful. You pace yourself, and that's it. Let me know what you think about, if you liked it, if I've helped you somehow. I'd appreciate it if you liked the video. So thank you very much, and see you on the next one. Bye bye.